everyone, my name is Jeannie Rouse and I am a student BSN with Indiana State University, and I am doing a health education project, and my topic today is oral care in school-age children and their impacts on learning. So we're just going to go through some slides here. These are our learning objectives. We're going to explain common behaviors children exhibit when in pain and how it affects their learning ability. We're going to define tooth decay and gum disease and identify common symptoms of each. We're going to explain the use of sealants and how those are used. We're also going to identify signs and symptoms of when to seek oral care. And we're also going to identify ways parents can help their children have good oral health care. This is a pre-test. What I would want you to do is prior to going forward, just pause the video and read these questions and answer them on a sheet of paper and just kind of see like what kind of knowledge you have, and then we'll go through the presentation. Then there'll be a post-test and we'll see if you learned anything or if things were wrong. So here we're going to start. Did you know that children suffer in school when they suffer from bad oral health like tooth pain, abscesses, or the inability to chew? Pain caused by tooth decay can make children feel sad, worthless, depressed, and inferior. They're also less likely to be friendly compared to children without oral health problems. Early tooth loss can result in failure to thrive from the inability to chew from the pain or a decreased appetite, leading to not having adequate nutrition. They can also develop speech development problems and have reduced self-esteem in school. Did you know that dental injuries occur in 1 in 14 children ages 4 to 14 annually, and that can also cause aesthetic, psychological, and social problems? Children also cannot verbalize their pain like adults, especially oral pain. They often express this pain as difficulty attending the class lecture, anxiety, fatigue, anger. They can be withdrawn, not want to participate in activities they once enjoyed. Teachers are often the first ones to notice these symptoms just because school-age children spend a lot of time in school. And then did you know that dental cavities are 4 times more common in childhood than in asthma and 7 times more common than hay fever? And as you can see from the slide, this is the impacts of dental pain on learning. Children can have decreased attention, decreased concentration, failure to thrive. They can have increased or missed school days more than a different type of child without oral pain. They can have different types of feelings like worthlessness, depression, anger, and then they're also less likely to complete their homework in school and at home, which also results in just decreased learning because they're not able to do their homework. Now we're going to talk about tooth decay and gum disease. Do you know more than 4 in 10 children have tooth decay in their baby teeth? Tooth decay can cause breakdown or destruction of teeth that leads to holes in the tooth, kind of like this right here. This one too. Tooth decay is caused by sugar and acid from food and drinks that eat away at the enamel, causing cavities. So the bacteria and plaque produce acid as it feeds on the sugars from the foods that you're eating, and then those acids is kind of what breaks down your tooth enamel to create the cavities. And then if plaque is not removed, it hardens into what we like to call tartar, and that's like the hard, crunchy stuff on the outside of your teeth there. It's a very common spot to get tartar. And it's very hard to brush off, and as it builds up, the tartar, it can lead to gum infections, inflammation, and like gum disease. And then foods that can contain high levels of sugar could be anything from milk or soda, candy, any kind of juice. It could also be inside of starchy stuff like cereal, breads, pastas. The risk factors for increased tooth decay include high levels of bacteria in your mouth. So some people just inherently have more bacteria in their mouth naturally. A diet high in sugar and starches can also be a high risk factor. Having a water supply that doesn't have any fluoride in it. There are some counties in the United States that still do not have fluoride in their waters. Poor oral hygiene, just not brushing your teeth or flossing as often as you should. And then if you have less saliva flow in your mouth, it can cause just dry mouth, and that helps the bacteria grow more. And then symptoms of tooth decay and gum disease can include things such as tooth sensitivity to hot or cold items. You can get discoloration on your teeth, like white spots, or your teeth can turn brown or black. You can kind of see like In this picture here, there's some decay, a little bit of brown right there, kind of right there. And it likes to hang out on like the crevices of your teeth or in between the teeth here, kind of like right here in the roots. And then what can help keep cavities at bay in children? So fluoride and sealants are two things that are definitely helpful for children. Fluoride is a natural mineral that protects teeth. Fluoride makes teeth resistant to decay by helping to kill the bacteria in the crevices and on other areas. You can get a fluoride varnish on your children's teeth. You can always get them at their well child checks in their regular primary care office, and you can definitely get it at a dental office as well. And then currently the tap water in our county, which is Multnomah County in Oregon, it does not have fluoride in their water. So currently we have to give out fluoride tablets to any kind of school-aged kids and younger kids as a supplement. That starts at age 6 months and it goes up to 5 years. And the primary care physician orders those, and they can also get it from a dentist, but generally primary care is a lot easier to get the fluoride tablets. And then sealants. So sealants are thin plastic coating that's painted on the back of children's teeth to prevent decay. Sealants have to be placed in the dental office or by dental personnel. Clinics, Sealants are painted on, and it only takes a couple seconds for it to harden, and it'll harden into that plastic coating. Sealants are very important because the back teeth need extra protection due to being a major chewing tooth. They are more susceptible to decay from being rough and uneven, and then food and germs live in the grooves and pits of those teeth. And for some reason, like toothbrushes just have a harder time getting to that area as well. Children should get sealants as soon as permanent molars start to appear. So first molars appear in children ages 5 to 7, and then they will get a second permanent set at ages 11 to 14. So once those start coming up, you should make a dental appointment to get sealants on. And then baby teeth can also get sealants. Baby teeth also need to be cared for because they save the space in the mouth for the permanent teeth, so teeth can come in straight and not crooked, and they're not misaligned. Sealants do last 10 years, but they do need to be checked regularly at the dentist so that they can be repaired or replaced. And then currently, Portland Public School Districts have a program for everyone that's in grades 2, 3, 6, 7, and 8, where the county will come in and place sealants on children for free. All parents have to do is get a permission slip, usually from the school. They'll hand it out, and as long as the parents sign it and give it back to the school, the oral health team at the county will come and paint those sealants on your children. And then what can parents do to help? Well, parents can start cleaning or brushing their children's teeth as soon as they come in, especially like a baby teeth. You can use a cloth or just a soft bristled toothbrush. Kind of gets the child used to having things in their mouth and just keep some of the germs off. Teach young children, and any child at that matter, to brush their teeth at least twice a day, once in the morning, once at night. Especially, and then make sure, like, if they're unable to do it, like, make sure that if they can't do it by themselves, like, you're there to watch them and maybe do it for them. You can also make it fun for some of the younger children, like have a song that you're playing so that they can brush their teeth for the straight 2 minutes. Have favorite colored toothbrushes or their favorite flavor of toothpaste, or you can have like a checklist with stickers. Please make sure that children do not swallow toothpaste, and you can start using toothpaste when they are age 2 to 3. Make it a very, very tiny amount, no more than a pea size. You can also teach your children how to floss their teeth. They make these tiny little kid tooth flossers that are like plastic and dinosaur shaped that you can get at the store, and it just helps a little bit so they can get at least some flossing done. Do it along with them just so like they know that you're also doing it, and they'll be more willing to do it with you. Give children low sugar drinks and food. Make sure they get adequate calcium in their diet for tooth development, and then limit sugary snacks and fluids. And then take your children to the dentist for regular checkups every 6 months. And don't leave a child with a bottle in bed. A lot of people like to do this. Milk and formula or juice or any kind of soda in the bottle will just stay on their teeth all night, and that increases their risk of tooth decay. If they need a bottle, it's highly recommended to make it just water. They'll just use the bottle more for like a soothing thing. And then when to seek care from a dentist. So children can start seeing the dentist at age 1. Helps get them used to it, see the chair, see the instruments, hear the sounds, and kind of gets them geared up. It also allows the parents to ask any kind of questions about baby teeth and any kind of care that they may need. You can also get sealants there. And then anytime a child is acting up in school or maybe has a fever, maybe they're not doing very well in school, or they're always complaining of pain, or like a headache especially can be caused from dental pain. Any kind of losing weight or decreased eating, any kind of bad breath or failure to thrive. And this is just a little blip about PPS schools. So Fabian Elementary in particular has a full dental and medical clinic located within their school. So the children there can definitely access those services on a regular basis. It says that they're open Monday through Friday, and it has a phone number there. They do see anyone with OHP or commercial insurance, and good part is the children doesn't have to leave their school. They can come down out of their classroom, get checked out by their parent or guardian, and then just be taken right up the hallway to be seen. That way they're not missing any class time or anything like that. And then for more information, you can go to any of these websites. We have one here that talks more information about sealants. This is the county resource program, where that's the school sealant program. So if you have any concerns or questions about the individuals that go to the schools to put the sealants on, that is their website. This one also just is like about healthcare clinics within Portland Public Schools. They do have a fair number of health clinics in the schools. Only Fabian Elementary has a dental clinic, but the other ones can make referrals out to a dental area. And then just in case you have commercial insurance and you don't know what's covered under dental services for your children, this is just a website for the ACA coverage for dental now. And here's this post test. Like I said, all I would need you to do is pause the video, read these questions, see if you learned any knowledge from this. Maybe you learned some things you didn't know. And then and here's my references. This is where I got all of my information and things that I talked about, so if you wanted to just double check. And at the very end here, I made a flyer just to be handed out at a in-person seminar for this. This is what it looks like. It kind of just goes over everything that we talked about. So thanks for listening, everyone. Have a great